Welcome to the Basic Obstetric Ultrasound Training Course for Healthcare Providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials available at tinyurl.com/UW ultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams Waldorf, and I will be narrating the 7th video in our Pregnancy Ultrasound series. This video will teach the basic anatomy of the female pelvis as seen with ultrasound. Please visit our website for access to all of our videos and training materials. In this lesson, you will learn how to identify the uterus, cervix, the internal cervical os, ovaries, follicles, and fallopian tubes on ultrasound. Follicles are ovarian cysts where eggs develop. You will also learn how to identify the most common abnormalities of these organs that might present during pregnancy. The uterus has 2 parts, the body of the uterus and the cervix. The body of the uterus is the main part and is sometimes called the corpus. The lowest part of the uterus is called the cervix. The top part of the uterus is often called the fundus. The lining of the uterus is called the endometrium. The ligaments help to hold the uterus in place. The broad ligament helps to attach the uterus to the sides of the pelvis. Adnexa is a term that refers to both an ovary and fallopian tube, which are located next to the uterus. For example, one might refer to a mass imaged on ultrasound as coming from the right adnexa, because it wasn't clear whether it was coming from the ovary or the fallopian tube. The eggs form in the ovaries and travel to the uterus through the fallopian tube. Here's a drawing of the female pelvis in the sagittal plane. The left side of the image is towards the patient's head, and the right side is towards the feet. You can see that the bladder is in front of the uterus, and the rectum is behind the uterus. The transducer would be placed just above the pubic bone. A full bladder allows the sound waves to pass through the fluid and nicely image the uterus. Note that there's a space behind the uterus called the posterior cul-de-sac, where fluid can accumulate if the woman has a ruptured ovarian cyst or ectopic pregnancy. Here is an ultrasound image of the uterus in the sagittal plane. The left side of the image is towards the patient's head, and the right side is towards the feet. We have labeled the bladder, uterus, fundus, and cervix to make them more obvious. In a non-pregnant uterus, the cervix is not easy to identify on a scan. It's simply the bottom part of the uterus before it turns into the vagina. The fundus is simply the top part of the uterus. There are no clear signs or markers for these regions. This is another sagittal drawing of the pelvis. The uterus can be in different positions, all of which are considered normal. It can be positioned tipped back toward the sacrum, called retroverted, as shown in position 1. It can also be positioned in the midline, as shown in 2, or tipped forward toward the pubic bone, which is called anteverted, as shown in position 3. The uterus is pushed into its position by pressure from the structures around it. Applying pressure to the uterus or ligaments can change its position. This pressure can come from bowel activity, bladder fullness, body position, or ovarian masses. Applying pressure to the uterus or ligaments can change uterine position. These are sagittal images, so the bottom is posterior. In both images, the uterus is anteverted or tipped forwards towards the bladder. In the left image, the uterus is tipped sharply anteriorly. In the right image, the uterus is less anteverted because the bladder is fuller. The full bladder helps to see the uterus because it puts the uterus more perpendicular to the transducer. The bladder also acts as an ultrasound window, which gives you a better view of the uterus and the fetus if the patient is pregnant. Here in each image, the uterus is tipped posteriorly, which is called retroverted. Can you see the bladder and uterus here? Please pause the video now to give participants a chance to identify the bladder and uterus. Here we have labeled the bladder and uterus in each image to make them more obvious. The fundus, or top of a retroverted uterus, is sometimes difficult to see clearly. Remember that the cervix is the lower part of the uterus. It can be seen by ultrasound in non-pregnant and pregnant women. Here we have labeled the cervix from a woman who is not pregnant. The cervix is often easier to see in pregnancy. Please pause the video now to allow participants to identify the bladder and cervix in both images and what is unique about the image on the left. Here we have labeled the bladder and outlined the cervix in both images to make them more obvious. Did you identify what was unique about the left image? The answer is that we see two fetuses, each in its own gestational sac with a dividing membrane. This means that this is a twin pregnancy. Can you identify the round structure to the left of the bladder in the right image? The answer is that this is the fetal head. Next, we will look more closely at the cervix. The internal os is the place where the cervical canal meets the uterus. You cannot see or feel the internal os on clinical exam. Here we have outlined the cervix to make it more obvious. We have also labeled the bladder and fetal head. Now we will remove this outline of the cervix so that we can show the cervical canal and the internal os. You should attempt to image the cervix in every scan until late in pregnancy, because an abnormal cervix can be a warning sign of problems during delivery. Sometimes you can't see the cervix well until late in pregnancy. For example, an internal os that is open, called funneling, is a warning sign of preterm birth. A cervix that is shorter than normal, less than 2.5 centimeters when imaged before 24 weeks gestation, is also associated with preterm birth. In both of these pictures, we can see the fetal head and an open internal cervical os. There is fluid in the cervix, so it looks anechoic. If the cervix had started to funnel and open only on the fetal side, you wouldn't be able to determine this on pelvic exam because the outer cervix would feel closed. You could see this easily by ultrasound, as in the image on the left. When the cervix opens even further, like the image on the right, You may be able to see the membranes bulging into the vagina when doing a clinical exam. This is what it would look like on ultrasound. Fibroids are also called myomas or leiomyomas. They are benign tumors of the uterus, but can cause problems like pain or bleeding depending on their size and location. They are fairly common in women, especially in older age. They are very important to detect during pregnancy because they can grow larger and cause pain or make vaginal birth difficult. Fibroids can develop and look different in many places in the uterus. It is not important to know the names of the locations, but just know that fibroids can occur in the uterine lining, in the wall, on the outer surface of the uterus, or in the cervix. Notice that fibroids often look round. The upper images are sagittal and the lower image is transverse. All images are from the same uterus. These images show a fibroid in the posterior uterine wall. The uterine wall is the most common location to see a fibroid. Here we have labeled the bladder, uterus, and fibroid to make them more obvious. The upper images are sagittal and the lower is transverse. Again, these images are all from the same uterus. Here the fibroid is in the uterine lining. In fact, it has grown to fill the entire space of the endometrial cavity. We have outlined the fibroid here. If a fibroid has grown large within the endometrial lining like this one, it is likely to cause irregular and heavy vaginal bleeding and even anemia. In the sagittal scan of the uterus, we see a bulge on the lower anterior wall of the uterus. This is a fibroid that is located mainly on the outside of the uterus, but a part is also in the endometrial lining. These images show fibroids near the fetal head and next to the placenta. Please pause the video now to identify the fibroids within the group. Here we have labeled the fibroids, fetal head, and placenta to make them more obvious. Fibroids often grow during pregnancy. If they are large and located near the lower part of the uterus or in the cervix, they can interfere with a normal vaginal delivery. If you identify a fibroid in pregnancy, be sure to reevaluate the patient, especially in the third trimester. The patient may need a C-section, depending on the size and location of the fibroid. We cannot see the fetus in this image, but we can see amniotic fluid to the left. To the right, a large fibroid blocks the birth canal. This cervical fibroid will likely interfere with a vaginal delivery, so this patient needs a C-section for delivery. Now we will talk about the adnexal structures next to the uterus, which means the ovaries and the fallopian tubes. Please review the locations of all these structures on the diagram. As you recall, eggs form in the ovary and travel to the uterus through the fallopian tube. The ovaries normally vary in size, shape, and echogenicity. The average size of an ovary is about 3 by 1.5 by 1.5 centimeters in women of childbearing age. Ovaries are especially difficult to see in later pregnancy because they are pushed to the side by the enlarged uterus. Here are two examples of normal ovaries. In the left image, the ovary is round and solid and sits next to the uterus. The ovary in the right image has a more common appearance. They are outlined here. The ovary is normally oval and contains dark round or oval structures called follicles, which are developing eggs. The ovary produces an egg each month in a follicle. Normal follicles appear as small cysts throughout the ovary. First, we will outline the ovary. Now, we will remove this outline to better show the follicles. In this ovary, there are at least 4 and possibly a few more small follicles that are visible. Follicles can vary in size, and that is normal. Here we show both a single dominant follicle that is a bit larger on the left and a small follicle on the right. They are outlined here to make them more obvious. Most follicles are less than 3 centimeters in size, but if the follicle measures more than 5 centimeters, it might cause pain, and you should follow up with another ultrasound in 6 weeks. You cannot see normal fallopian tubes on ultrasound, but if a tube becomes blocked or infected, it may get large enough to see. The fallopian tube is also the most common site of an ectopic pregnancy. An ectopic pregnancy is any pregnancy that occurs outside the normal place in the uterus. An ectopic pregnancy usually occurs in the fallopian tube, but can also occur in the ovary, the abdomen, and the cervix. An ectopic pregnancy occurs in 1 to 4% of pregnancies. Ectopic pregnancy can be identified on ultrasound. Ectopic pregnancies are prone to rupture, and the bleeding can threaten the life of the mother. We will talk more about how to identify an ectopic pregnancy in a later lesson. Let's review the key points. The uterine position can be anteverted, midline, or retroverted. All of these positions are normal. A very short cervix is associated with preterm birth. Fibroids are benign tumors and are common. In pregnancy, fibroids can interfere with delivery when they are large and located in the lower uterus. Ovarian follicles are normal. Follicles larger than 3 centimeters can cause pain. Ectopic pregnancy can also be identified on ultrasound. Here are questions for review. Name at least 3 important structures in the pelvis. The answer is the uterus, cervix, internal cervical os, ovaries, and follicles. What can make the uterus change position? The answer is pressure from other structures like the bowel or bladder, changes in body position, and ovarian masses. Is it considered normal to have a retroverted uterus? The answer is yes. All uterine positions are considered normal. A cervix that is opening or funneling can be an early sign of which complication? The answer is preterm labor. This is also called an incompetent or shortened cervix. Why is it important to identify fibroids during pregnancy? The answer is that large fibroids can interfere with vaginal delivery when they are very low in the pelvis. Can you see fallopian tubes on ultrasound? The answer is that if fallopian tubes are normal, you cannot see them on ultrasound. If you can see a fallopian tube, it is abnormal. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause the video now to ask your instructor any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, and Stacy Lissett. Finally, we wish to thank Dr. William Marks for the use of images from his book, Ultrasound: A Practical Approach, and Jennifer Summers and Jan Hamanishi for graphic design and illustrations. The University of Washington Department of Radiology has trained healthcare workers in pregnancy ultrasound in many parts of the world. If you have questions about this video or course, please contact Dr. Robert Nathan, Dr. William Marks, or Dr. Christina Adams Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies. Please visit our website at tinyurl.com/UW ultrasound to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original basic obstetric ultrasound training for midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.